defensive medicine reforms. There are other things we could do with electronic records, with having more openness, with allowing us to actually shop around for our health care, so there's transparency in the system. In Medicare, we need to, I think there's other areas that need reform. In the insurance world, we need to be able to transfer our insurance between companies. We need to be able to trade across state lines. We could open this up and bring down the cost of healthcare by doing some simple fundamental reforms. But keep in mind that this healthcare is not so much about, this bill is not so much about healthcare as it is about controlling our lives. Called cap and trade, I refer to it as cap and tax. If that bill becomes law, the average American will pay about $1,000 or more a year for energy, either in the form of utilities or in gasoline for his vehicle or diesel fuel, or buried in the products, because everything we purchase today is transported in some fashion. So the cost of all that would be going up. But that, again, was about control of our own lives. Most people don't know, but in the legislation, it had a smart grid that supposedly more equitably distributes power in America. In that smart grid, we also lose control of the thermostats in this building and in our homes. If the demand is too high, the government wants the ability to raise the temperature in our house in the summer. And if it's too much in the winter time, to lower it. So there's loss of freedom going on in some of this legislation, but the energy bill was really to pay for socialized medicine, one-payer, single-payer system medicine, because the taxes, even though they're $1 trillion, for this bill alone, it's not enough to cover what they want to do. So thank you. We'll keep fighting for it. Thank you for the question. Yes, sir.
Thank you, Congressman. Appreciate your service. I have voted for you, and I consider myself non-Republican or Democrat, though.
Thank you.
I'm a small businessman, minimum 50 employees. Recently, I liquidated my businesses based on this bubble economy that we've entered into. Just to give you an idea, we had about 50% equity 5 years ago, and it came to zero this last year. That is, in a nutshell, what's happening across the country, valuations. The point of my question is, everything mentioned here shows a serious decline in this country and its ability to grow. Most of the legislation defeats the purpose of growth that I have seen. And I'm sure you understand that that goes against the founding of this country and the freedom that we all had some time ago, before my lifetime, I guess. My problem is not with health care or even the legislation of immigration, etc. Most of those things can be cured with a growing economy. So my question to you is, are you familiar with John Linder in Georgia?
I know him, and I'm also the original co-sponsor of the Fair Tax.
Fair tax.
Yeah.
Fair tax.
I went to the chairman of the Ways and Means Committee, which has all the tax policy come through it, and I asked him before a hearing on the Fair Tax, and he said, we're not going to do that while I'm chairman. Right. So until we change chairmen, Mr. Linder and I will have an opportunity to at least have the debate. Let's at least have the debate. I see some great advantages in it, in growing our economy and bringing jobs back to America, and I want to have that debate.
And the debate's been going on now for 4 years, and
But not in Congress. It needs to go on in Congress.
I agree.
Well, I can, way to fix that is get a different chairman. I mean,
I just got a letter from Senator Brownback on the very question that I just posed to you and what your viewpoint was. Nothing in the letter would point to anything going forward in the legislation that is now sitting in the Senate side in the Finance Committee. In other words, it's been sitting there now for, I believe, 9 months, he said in the letter, and has not even come up on the agenda. This is something that politicians don't want us to see. And not speaking to you, of course, I believe in you, Senator Tiahrt. But somebody has to take the initiative and get the ball rolling. What is your view of the Fair Tax Act as it sits? Are you familiar with it?
Yeah.
And if you're not familiar with it, please go to fairtax.org and teach yourself. Learn what it's about.
I've read the book, I've read the legislation, I was the original co-sponsor of the legislation, I understand how it works. But what needs to happen in America is a change in leadership in the House of Representatives. You know, Ronald Reagan said in 1978, when our country was in a recession, Ronald Reagan said, a recession is when your neighbor loses their job. A depression is when you lose your job. A recovery is when President Carter loses his job. You can change that to say today when Nancy Pelosi loses her job.
I think without that kind of support throughout our country, the way they speed read these bills, thousands of these bills through Congress, less people got involved, this health care that already been passed by the House, the Senate, and signed into law. And there's a lot of problems with it, with decent health reform. But I think everybody here would agree that it's not a fair playing field for Boeing to compete against Airbus because they're subsidized by the European government. We get a public option. It's going to be subsidized by the government, private insurers are not going to do it. We're going to all end up on public money. My question is, Congress can exempt itself from this bill, from this bill. Also, I'm assuming that the President and his staff. I'd just like to know why are they exempt? I know they got exempt from Social Security. They're on a different plane than we are, and Social Security's got problems. I think if we don't have a public option, which I hope they don't, it seems to me like Congress, President, all their staff are doing the same thing.
For those of you in the back, what he was asking about, since it's unfair to have competition with the federal government and the private sector, what are we going to do about the public option? The second part of that is, what are we going to do about Congress and the President? Are they going to live under the same health care plan? The first part, the public option won't be a fair competition with the private health insurance industry. And why this is such a bad idea, today in health care, 60% of health care is paid for by private insurance and 40% is paid for by public funding, either Medicaid, Medicare, or the VA system. I've talked to over 100 doctors, I've been to at least a dozen hospitals, more clinics, and in every situation, they've all told me that they have to shift money from what they receive in the private health insurance to cover the shortfall of what they get from public funding. So as we shrink the private insurance of it, there's going to be less money available in public health insurance, or in healthcare in general, but for less money available in hospitals because of the public funded portion expanding. Now the current estimates are that the public option would be about 44% of the cost of the private. If healthcare is already underfunded by public and they reduce the amount of income coming to the health community by 44%, that means we're going to have this much healthcare and this much money. So something's going to have to give, and rationing is the logical choice. And if you look at the bill, it's all set up to usher in some form of rationing, either through comparative effectiveness or for the decisions that some of these panels will be making in this process. The second portion of your question was about will Congress and the White House administration live under this. I had an amendment in the Appropriations Committee on Labor, Health, and Human Services that said, basically, if you vote for this, you get it. Every Democrat on the committee voted no. Every Republican voted yes. Now, I'm currently on Blue Cross Blue Shield. I buy my own health insurance for me and my wife. Our kids have their own insurance plans. I like my private health insurance. I don't want the government taking it away from me. I'm also, by the way, I pay Social Security. A lot of people on the internet think I don't pay Social Security. I'm in Social Security as well. But it's a good question.